Hi everyone, welcome to Nursing Hub. Today in this video, I'll be explaining about Neuman's system model and its application in nursing process and nursing research. Before going into the theory, let's have a look into her history and background. So Betty Neumann was born in 1924 in Lowell, Ohio. She completed her BS in nursing in 1957 and MS in mental health public health consultation from UCLA in 1966. She also holds a PhD in clinical psychology. She was a pioneer in the community mental health movement in the late 1960s. She began developing her health system model while she was a lecturer in community health nursing at University of California, Los Angeles. The model was initially developed in response to her graduate nursing students' expression of a need for course content that would help them to learn the breadth of nursing problems prior to focusing on the specific nursing problems, which means overall, what are the main nursing problems when they are caring for a patient rather than concentrating on a specific nursing problem areas. The model was published in 1972 as a model for teaching total person approach to patient problems in nursing research. It was refined and subsequently published in the first edition of Conceptual Models for Nursing Practice 1974 and in the second edition in 1980. When we look at the assumptions which helped her to make the theory, there are 10 assumptions she made before developing her theory. So, the first assumption is, though each individual client or group as a client system is unique, each system is a composite of common known factors or innate characteristics within a normal given range of response contained within a basic structure. So she says that each individual is a unique person and they will have some kind of innate characteristics within their normal range, and their response will be depends upon the basic structure. So we know that I will be different from you and you will be different from other person. So each person has their own innate characteristics and we will be responding to some of the things that is depends upon our innate characteristics. And she says in the second assumption, many known, unknown, and universal environmental stressors exist. Each differs in potential for disturbing a client's usual stability level or normal line of defense. So we know that when we look into our life itself, we have many known or unknown or universal environmental stressors, and we will be disturbed with those kinds of stressors, and our stability will be out when we get some kind of stressors. It can be in the form of any disease conditions, or it can be in the form of any job loss, or it can be maybe it can be like when we are moving into a new place. So the stressors may be in different types, and sometimes it cannot be, we will not be knowing what is the cause of stressor, but we'll be having some kind of anxiety. So these all things can affect our physiological, psychological, sociocultural, developmental, and spiritual stability. So it can affected by any kind of stressors. The third assumption says each individual or the client system will be evolved when there is some kind of response from the environment. So that kind of response will be helping the person to live in a normal wellness state. And the fourth one is when the cushioning accordion-like effect. Accordion means it's a kind of musical instrument which can be expanded or compressed. So those kind of effect which is happening to the flexible line of defense, then the flexible line of defense is no longer be able to protect the client or the client system against the environmental stressor. So what happens? This stressor will be breaking through the normal line of defense, and the interrelationships of variables will be affecting with the things. That is, those interrelationship variables are physiological variables, psychological, sociocultural, developmental, and spiritual variables. So these are the main things in the fourth assumption. Then in the fifth one, the client, whether in a state of wellness or illness, is a dynamic composite of the interrelationships of variables, that is physiological, so psychological, sociological, and developmental and spiritual. So wellness is on a continuum of available energy to support the system in its optimal state. Then the sixth one is implicit within each client system is a set of internal resistance factors known as lines of resistance, which function to stabilize and return the client to the usual wellness state, that is to the normal line of defense, or possibly to a higher level of stability following an environmental stressor reaction. So these things will be cleared when you are looking into the main concepts of the this system model, because this assumptions, first she had an assumption, from the assumption she made the concept. So when you look into the concept, when that is when coming into the later parts of the slides, you will understand clearly what it says. Then seventh assumption is primary prevention relates to general knowledge that is applied in client assessment and intervention in identification and reduction or migration of risk factors associated with the environmental stressor to prevent possible stressor reaction. And secondary prevention relates to symptomatology following a reaction to stressors, appropriate ranking of intervention priorities, and treatment to reduce their noxious effects. And tertiary prevention relates to the adjustive process taking place as a reconstitution begins and maintenance factors move the client back into a normal manner toward primary prevention. And the last one is the client is in dynamic constant energy exchange with the environment. So I can conclude these assumptions into some points. That is, mainly she says there is a client or client system. So this client system is the basic structure, that is an individual. So when the individual has some protectors, protective lines in ourselves. So those things are evolved from the some kind of experience which happened in the environment. So what happens when the stressors comes, these stressors can break our normal line of defense or flexible line of defense, and this will be affecting the client system, that is in the way of we may have some kind of diseases or some kind of issues. So what will happen, the nurse comes and she will be in giving us the three kinds of prevention methods, that is primary prevention, secondary prevention, and the tertiary prevention. So this, as we know already, the primary prevention is before occurring the disease we will be identifying the risk factors and treating it, and secondary prevention, after developing some kind of symptoms we are getting the treatment, and in the tertiary prevention, once after getting all these we are trying to maintain a wellness state. So these things are happening. So all these things will be happening when once the client system is trying to maintain the normal things. So from the part of client also we need to show some kind of cooperation, then only we can have the normal wellness state. So it is always a constant energy. So according to the system model, she says that it is a client and environment has always, there is an exchange of energy levels. Hope it is clear for you. Now let's have a look into the key concepts of Neuman's system model. So the first concept in her system model is a client. A client has a basic structure, line of resistance, normal line of defense, and flexible line of defense. I'll explain all this one by one in the later slides. Then the second concept in her model is variables. There are physiological variables, psychological variables, developmental variables, sociocultural and spiritual variables. Then next is nursing interventions. So in the nursing interventions, there are primary intervention, secondary intervention, tertiary intervention, and reconstitution. Then there is an environment. The environment can be internal, external, or created environment. Then there can be stressors, that is intrapersonal stressors, interpersonal stressors, or extrapersonal stressors. And the next one is wellness. The wellness can be entropy or negentropy. When we look into the client system, a client system is a series of concentric circles surrounding a core or basic structure depicts the client system in a Neumann model. And each line of defense or resistance has certain distinct properties, but the main function is to protect the basic structure and help maintain the system in a stable state. So client system is a person, that is for example I or you, and we have some concentric circles around that which helps to protect and keep the system in a stable state, and we will see what are they. If we look into the system model, we can see the client system, and the client system is protected by some kinds of distinct lines, some lines. We can see the lines. So those lines are mainly helping to protect the client from all kinds of problems and helps to maintain the structure in a stable state. So in the Neumann model, the client is a synonym, that is the other name for the person in the metaparadigm concept. And also so in here the client depicts, we can say it is a collaborative relationship between the caregiver and the care receiver. Not always so interacting, but when we have any kind of illness or any diseases, we will be approaching the caregiver. When so the they will be helping us affected. To maintain so the caregiver helps to, or the carer in helps our to health. Maintain a state so of their main role is to keep us and well, also the client, and our role is Neuman's to model, go and approach the caregiver the client can when our system is not a system stable. That interacts with and the also environment. In the system model, therefore the client may be defined as an individual, family, any system group, that or interacts community. With the environment. So that is it can be an in individual the system model, or Neumann group mainly or family or the community. It's not, the client for example, is not only an individual. It can be communicable a family, disease, group, it is present or it in can our be a community. So the whole community the system is affected. That, so here the client system is the community. It can be a family, or if the problem is only in our family, it can be so death of any person, or it can be a disease community of the, is affected person. With some kind so of communicable diseases. Is affected. So in that case, the community is affected. The community is the so in client. The system model, the client is not only an individual, it can be any person, like it can be a family or it can be a community. Neumann also believes that the client is in an open system. The relationship of the client to the environment is reciprocal. Therefore, the client both influences and is influenced by the environment. For example, I can tell you, if a person is sitting in an office where there are many smokers, okay, so in that case what happens, this person, the person who is not smoking, is prone to get any kind of respiratory illness. So that person is affected by the environment. That is, the environment is that smoking environment, and the person who is not smoking, that person is more prone to develop any kind of respiratory illness. Here what that person can do, that person can go and inform the manager that to have a separate smoking room for those who are smoking, or ask the manager to make him sit in a place where there are no smokers, non-smoker people are sitting. So thus what happens, that person is protected from all kinds of respiratory illness. That is why Neumann says that the relationship of the client to the environment is reciprocal. Either the environment can affect us if we are not reacting to it. So if we are reacting to it, we can do some kind of modification. Now if you look into the picture, we can see the client system is a circle surrounded by a series of concentric rings. These rings act as a protective structure for the inner circle known as the basic structure. So what is a basic structure? Which includes the innate energy resources necessary for the survival of the client. These resources are conceptualized as the survival factors of the species, the genetic features, and strengths and weakness of the system parts. For example, if the client is defined as an individual person, that is, if you or I, then the basic structure would include the mechanisms for maintaining a normal temperature. So in order to live, we need to have a normal temperature range, we should have a normal genetic response patterns, and we have some strengths or weakness of the body organs. So based on that, the client system will be responding to the environmental factors. So this picture clearly depicts how is a client system. That is the basic structure, energy resources is surrounded by a dark circle in the middle. You can see that, and around that you can see many dotted lines, that is line of resistance, and above that we can see a normal line of defense which is in the dark circle, and above that again we can see one more dotted line, that is a flexible line of defense. Now, if we consider a family as a client, then the basic structure includes resources for survival of the family unit. This includes the genetic pool of the individuals within the family, financial resources to maintain the family, and the ethnic or cultural history that provides and maintains the family identity. So that already I told you, it can be if the family has any kind of issues. It can be financial issues, or it can be any disease conditions in the family, the system will be affected. Now, again, have a look into the client system. So you can see the concentric rings around the basic structure. That is the resource for protection of the core system. That is the outer ring, which is known as the flexible line of defense, forms the outer boundary of the client. This boundary functions to protect the normal line of defense or the usual state of wellness of the client. And the flexible line of defense is a buffer for the client and is the first line of defense in response to stressors from the environment. So when we have any kind of stressor, this is the line which is going to protect us. The first line, that is the flexible line. So the flexible line of defense, it is not only to keep the normal state of wellness from being compromised, but also it can be used in order to improve the normal state of wellness. If we feel that we need to improve our normal wellness, so in that case also we can have the flexible line of defense. And also, as we already said, the accordion like. So it can be, accordion means, it's a type of like it's a musical instrument, so it can be like expanding or contracting. So depending on the needs of the client, this flexible line of defense can be used as an accordion. It can be contracting or it can be expanding. So as the flexible line of defense expands, it provides more protection, and when it contracts, it gives only less protection. And the ability of the flexible line of defense to function as a buffer system relates directly to the type, amount, and strength of stressors within the environment in relationship to the response or the reaction of the client. So the flexible line of defense will be functioning as a buffer that depends upon the type or strength of the stressor and how the person is going to react to that particular stress. If the number and variety of the environmental stressors increase, the buffer system is hard pressed to keep these stressors from impacting the normal functioning of the client. So, for example, as with a bumper on a car, if the speed of the car increases and the car comes into contact with a brick wall, the bumper will not be able to protect the car and passengers within the car from damage. So, like if the speed of the car is increased, if the speed of the car is increased means that is the increased stressors. If you have increased stressors, what happens? The car may go and hit into a wall. So the bumper on the car will not be able to protect from the damage of the car. That means the stressor is increased, so the damage also is causing, it is more. So the bumper will not be able to protect the car or those who are sitting in the car. Hope it is clear for you. Now let's have a look into the normal line of defense. So you can see the picture again. So it is the client's usual state of wellness. So it is a baseline or standard of functioning for the client. The normal line of defense develops over time and is affected by not only internal factors that influence the ability to maintain wellness, but also external factors. So we can say, like, as the age increases, the we know that how to react to each kind of situation. So when we are small, we may not be able to act in a proper way to a particular stressor or to a particular situation. But as the age advances, we know how to react to a situation. So that is the normal line of defense. It develops over time. So we told the normal line of defense can be affected by external or internal factors. Let's see what are those external factors and internal factors which affects the normal line of defense. So the external factors influencing the baseline functioning of a client includes environmental stressors of a chronic nature, that is pollution, altitude, etc., to which the client has adapted. The internal factors influencing the baseline functioning include patterns of health behaviors, lifestyle, and cultural influences. If a stressor breaks through the flexible line of defense and comes in contact with the normal line of defense, a reaction will occur within the system. Typically, the client will exhibit symptoms of instability or illness caused by the disruption of the normal stable state. So, any kind of these things, for example, the pollution. So, when the pollution comes, the first it will be affecting the flexible line of defense. And if the flexible line of defense is not able to protect us, then it will come in contact with the normal line of defense. And when the normal line of defense is having a defense is disrupted, then we will have the kind of illness due to the disruption of this normal stable state. The line of resistance, which is the closest to the basic structure. So the first is the flexible line, then the normal line, and the third one is the line of resistance, which is the closest to the basic structure, and it functions as a protective mechanism for the basic structure. The main purpose of the line of resistance is to protect the basic structure's integrity. They become activated following a stressor invasion through the normal line of defense. If the line of resistance are effective in their protection, the system is able to reconstitute and return to a steady state. When lines of resistance are ineffective, what happens? It can cause death of the system. Hope it is clear for you. So the next concept in Neuman's system model is variables. So according to Neumann, inherent within the client are 5 different variables. So each person have 5 different variables. These variables are similar to the domains of functions within the system. So let's see which are those 5 variables. So the first variable is physiological variable, that is relating to the body structure and function. The second is psychological variable, which is dealing with mental process and relationships. The third one is sociocultural variable, that is focusing on social and cultural influences. And the next is developmental variable, which includes life developmental process. And the last one is spiritual, that is incorporating the belief influences, creative aspects, and essence of life. So these are the 5 variables depends upon 5 variables according to Neuman's, which is mainly related to our body: physiological, psychological, sociocultural, developmental, and spiritual. Neumann says the 5 different variables may be at various levels of development. The variables pertaining to a child are not as developed as those of an adult. There is unlimited potential for interacting among the 5 variables. So a term coined to describe the interaction has been leaky margins, that is personal communication. For example, communication patterns. So communication pattern means a person's psychological variable, which is often influenced by the values of the society in which the client was raised. So we know when we go to different parts, our language or the way of communication is different from a communication from the other person. So that depends upon how we raised in the society. The next concept of Neumann is environment. So it is an important influencing concept of the Neumann model. It is defined as those forces surrounding man, both internal and external. And the internal and external environmental stress factors may have a positive or negative influence on the client. So for example, if you are going for an interview and we got that interview, still we'll have a stress, or we'll have a positive kind of anxiety or stress. So in the Neumann model, the three environmental typologies identified are internal, external, and created. So in the environment, the first one is internal environment, or it can be intrapersonal environment, which consists of all forces or interactive influences internal to or contained solely within the boundaries of the client. That is, in a person, the boundary would be our body. Other than that, whatever or whoever is coming, they are all from the external. So if I'm staying in a family, if I'm saying about the internal environment is my body and the reactions which is taking place in my body, the stressors or the feelings which is coming in my thing is the internal environment. The remaining everything is external to me. But when I'm saying in a family, when I'm considering my family as a internal environment, so in that case, what will happen? All the interactions in the subsystem would be those of individual family members. Now, the second environment type is external environment, which consists of influences of an interpersonal or extrapersonal nature. These influences are outside the boundaries of the client. So with an individual client, the external environment refers to the interaction of the client with another person, such as a work colleague or a family member. For when I'm staying in the family, so my external environment would be other family members or their reaction with me. With a family system as a client, the external environment may include extended family or neighbors. So when if we are considering the family as a client system, then in that case the external environment would be our extended family members or our relatives or our neighbors. Therefore, what may be an internal environment to one system may become an external environment to another. The crucial point is in defining the client system as one of the interacting system. So if you are considering the external environment, so when it comes to the family as a client system, the external environment, as we told already, it would be everything other than our family members. It can be our relatives or it can be our neighbors or anything. And if you're considering the community as a my community as a client system, then in that case the external environment would be another community. Those who are coming from another community would be the external environment. The third environment is the created environment, which is a newer term to the Neumann system model. It is the client's attempt to create a safe setting for functioning. An environment is created by the client if the client perceives a threat to the basic structure and function of the system. Neumann describes the created environment as largely made up of unconscious mechanisms that come into play as the system interprets the needs. The client may use not only internal but also external cues to create a safe place in order to operate. So, for example, a creating environment is a process a person goes through when moving to a new location. What we will do, the external environment is a new place and which is unfamiliar to us. It is a new city or new state or new neighborhood. So in order to decrease that feeling of discomfort or threat at the change in the environment, what we will do, we can arrange same furniture in the new house, or we can keep photos of the family members, or we can do some maybe the things which we brought from our family. So in order to decrease that threat or to decrease that stress in our individual system. So in order to maintain the system, in the case of created environment, our patterns of behavior also are kept. For example, morning coffee and the newspaper or routines of exercise, all to ease into and feel less vulnerable in a new situation. The people may adjust all those kind of things again what we were doing in the previous house or where we stayed before. So this rearranging of environment is not a conscious act in order to decrease the stress. Rather than it is an unconscious attempt to reduce the disparity between the new and unfamiliar and the old and safe. So these things, as a part of our life, we may be doing this, but it is not not a conscious thing which we are doing in order to reduce the stress, but it is an unconscious thing, that having a coffee in the morning or going for an exercise in the morning. So these are unconscious thing which is happening in our life day to day. The main goal of a created environment is to maintain system integrity, thereby allowing the system to function in a safe arena. When assessing the existence of a created environment, it is important to consider what environment has been created, how it has been used, and how it will be used by the client to maintain optimum system functioning. The next concept in Neuman's model is stressors. So stressors are a part of the environment. She defines them as a tension producing stimuli within the potential for causing disequilibrium. More than one stressor may be imposed upon the client at any given time. They may be present within or outside the client. So it is a thing which causes disequilibrium to our normal life process. That it is a tension producing stimuli. Now let's see what are the stressors within the environment. So the stressors can be identified, classified as to knows or possibilities, that is loss of someone close to us, or any pain or sensory deprivation or cultural change. So these can be a stressor. And may our personal factors, that is intrapersonal, interpersonal or extrapersonal factors, can be a stressor, or more than one stressor could occur simultaneously, or same stressors could vary as to impact or reaction. A normal defense line varies with age and development. Now, the different types of stressors includes interpersonal stressors, and extrapersonal stressors. So, if the intrapersonal stressors are the internal environmental interaction forces occurring within the boundary of the client or between the client subsystems. That is within an individual, or if you are in the family, if you are considering the family as a client system, then what is happening in the family, that is the intrapersonal stressor. Then comes to the interpersonal stressors, the external environmental interaction forces occurring outside the boundary of the client but at proximal range. For example, if I am the person and I am having some stressors, in the interpersonal stressors are coming from my family, and if I am considering my family as the client system, the interpersonal stressors are that is coming from my neighborhood, my family's neighborhood, or other family, other relatives. Okay. Then comes to the extrapersonal stressors, the external environmental interaction forces occurring outside the boundary of the client at a distal stage. Now, the stressor's effect on the client is related to two factors, that is, the strength of the stressor and the number of stressors impinging on the client at any given time. However, the stressor's effect also is related to the client's ability to protect against the stressor or change its effect on the system. Therefore, each client may have a different reaction to similar environmental stressors. So it depends upon mainly two factors, that is the strength of the stressor and the number of stressors which is affecting the client. But here one more thing, that is the stressor effect will be related to the client's ability to protect against that particular stress, or whether we will be able to change that particular stress into a normal thing. So here I'll give you an example, that is an individual who makes a decision to return to school for an advanced degree may decide to continue working full time. However, few students are able to manage the additional stress if they are enrolled full time in school while working full time. The additional stress of class attendance, homework, and faculty expectations to the normal stress load typically decreases sleep time, disrupts patterns of eating and exercise, and reduce leisure time. Such activities help maintain the flexible line of defense. Therefore, the student has weakened the flexible line of defense and may find himself or herself more susceptible to infections and disease, thus becoming ill when she can least afford to that particular thing. I hope it is clear for you. Now let's see what is wellness. The next concept of Neumann is wellness. So, health status is reflected by the level of client's wellness. Health and wellness are considered to be the same. When system needs are fully met, a state of optimal wellness exists and the client is healthy. Conversely, unmet needs reduces the wellness state. Wellness is a condition where all subsystems are in balance and harmony within the whole of the client. So when we have no stress or when we have no other kind of any issues, we are well. So that is wellness. So Neumann says varying degrees of health exist depending on the balance between met and unmet needs of the client. Thus, health is on a continuum from wellness to illness. We know the wellness to illness continuum. The wellness of the client is based upon the actual or potential effect that environmental stressors have an energy level of the system. For example, it requires less energy output to maintain a high degree of wellness for a client if the environment does not include air and water pollution. So we know nowadays it is a main issue, that is air and water pollution. So if that problem is not there, we can have a wellness state. So most of the problems which occurs due to nowadays is air and water pollution. So which is not helping us to keep a wellness state, a complete wellness state. When more energy is produced than used, the client is moving toward negentropy or a wellness state. When the system produces less energy than is required, movement of the client is toward entropy, or it is called as an illness state. The greater the entropy state or the illness state, the greater the imbalance between the needs of the subsystem and the energy available. Energy conservation is critical to the goal of system stability. So entropy is the illness state and negentropy is a wellness state. The next is nursing interventions. The next concept of Neumann is nursing interventions. The nursing goal is to keep the client stable. In system terms, the maintenance of stability requires that interventions are directed toward counteracting movement toward entropy or illness. Neumann describes nursing intervention by using the term prevention. The three types of prevention are primary prevention, secondary prevention, and tertiary prevention. The three levels of prevention are used to attain, maintain, and retain wellness by assessing system stability. So according to Neumann, the primary prevention means the interventions aimed at protecting the normal line of defense by increasing the flexible line of defense ability to withstand environmental stressors and decreasing the risk factors. Nurses use the secondary prevention interventions when the normal line of defense is disrupted, which is resulting in the client symptoms. Secondary prevention is aimed at strengthening the system's line of resistance and thus protecting the basic structure. And the tertiary prevention focuses on helping the client regain or return to a wellness state following treatment. So these primary prevention, secondary prevention, and tertiary prevention, it is same as we learn in the other things. So primary prevention mainly aims in preventing the disease or preventing the risk factors by by modifying the environment or ourselves. And the secondary prevention is mainly when the patient or the client has symptoms, we are treating the particular symptom. And the tertiary prevention is mainly focused on to return the patient into a wellness state following the treatment. The next is reconstitution. The term reconstitution describes the process of returning to a wellness state. Reconstitution may be viewed as feedback from the input and output of secondary intervention. So when we get the treatment, when we are returning to a normal wellness state, that is called as a reconstitution. The goal is to maintain an optimal wellness level by supporting existing strengths and conserving client's energy. So here in the reconstitution, the main goal is to maintain the optimum level of wellness by supporting the existing strengths, what the patient has or what the client has, what are the strengths of the clients, that we are trying to modify and to maintain a optimum wellness. So this is the picture depicting the level of prevention reconstitution. That is, as we told, like from the secondary prevention, the nurses are using the secondary prevention in order to treat the disease of the patient. So when the patient is treated with from the disease, we are doing the reconstitution. That is trying to get an optimum level of wellness for our patient, but it also depends on the personal factors, that is intrapersonal factors, interpersonal factors, and extra personal factors of the patient. So the Neumann model provides a framework from which to view the person as a system based on systems theory. The concepts that are client systems, variables, environment, stressors, wellness, and nursing interventions are derived from a variety of systems, that is stress and mental health related theories. The Neumann model is built on the assumption that the interaction of environment and client has both direct and indirect effects on the client's ability to maintain a state of wellness. The goal of nursing is to provide assistance for the client to best attain and maintain system stability as an optimal condition of wellness. When it becomes impossible for the client to conserve energy, the client is assisted in a peaceful and meaningful death. So here in this system model, Neumann mainly focuses on the client, the environment, and the nursing system. So when the client's wellness is not able to maintain, that is due to the environmental stressors or anything, then the nursing system will be acting in order to maintain the wellness of the person. So this is the detailed form of her system model. So here this includes whatever we talked just now. So here you can see the basic structure, that is as an individual we or I or you. So this is a basic structure or energy resources. So here you can see the basic structure, basic factors common to all organisms, that is the normal temperature range, genetic structure, response patterns, organ strength, weakness, ego structure, nons or commonalities. So these are common to all people. So this is our basic structure, and here you can see the dotted lines, the lines of resistance, then on top of that the normal line of defense, and on top of that we can see the flexible, the outer covering is the flexible line of defense. So when the stressor comes, so here you can see the where the stressor is coming. So the stressors are identified, classified as known as possibilities, that is loss, pain, stress, sensory deprivation, or cultural change. So any kind of stressors. So when the stressors comes, first it will be affecting the flexible line of defense. So if the flexible line of defense is disrupted, then it will go to the normal line of defense, and again if the normal line of defense is disrupting, it will go to the line of resistance. So if the line of resistance also can't protect us, then the basic structure or energy resources will be affected, and it can lead to the death of the person. So here comes the nursing interventions. So the nursing interventions can be like primary prevention, secondary prevention, and tertiary prevention. So any of these interventions will be used in order to reconstitute the person's normal wellness state. So it could begin at any degree or level of reaction. Range of possibility may extend beyond normal line of defense. And so these are the main things, and the reactions, the natural and learned resistance, time of encounter with stressors. So all these will be like how the person is. So based on the individual difference, it will be different for each person, the reaction which is taking place, whether to attain the normal wellness state within 2 days or within 5 days or within 1 month. So that all depends upon the person's reaction state. So that's all, which is very easy actually, but when we look into this, we will feel that it is so complicated, but it is very easy thing. Now let's see the Neumann system model and the meta paradigm. So the meta paradigm includes the person, environment, health, and nursing. So first is person. So already we have seen the person. It can be according to Neumann, she refers the person as a client system. So the client system can be an individual, family, or community, and it can have some variables. They are physiological variables, psychological variables, sociocultural variables, spiritual variables, and developmental variables. So these variables can be affected when there is an interaction with environment. Then the next one is environment. So the environment, as we already have seen, it can be internal environment, external environment, and a created environment. So she is mainly focusing the environment in her nursing model. So the internal environment we have already seen, that is exists within the client system. External can be outside the client system, and the created is when the person is developing it unconsciously, or it can be based on, in order to maintain the wholeness, the person is making it. Then the next is health. Health is, it is a state of being in wellness. So she defines health or wellness as the condition in which all parts and subparts are in a harmony with the whole of the client. So when the person is in the wellness state, it is called as a health. Then the nursing. So in the nursing, we have seen what the nurse does here. So the nurse is helping the client to regain their wellness state. So what they are doing, so the nurses are doing the primary prevention, secondary prevention, and tertiary prevention. Based on these nursing interventions, the nurse is helping the patient or the client to regain their wellness state. So the next part is application of nursing theory into the nursing process. So as usual, we know that the nursing process has 5 steps: assessment, planning, nursing diagnosis, intervention, and evaluation. So here in this theory or in the model, we have mainly 3 steps, that is nursing diagnosis, nursing goals, and nursing outcomes. So you can see the examples which I have given in the end of this nursing theory slides. The example which is given is very easy to understand how to apply a case into the nursing theory as a nursing process. And also I have given the nursing research how to apply in the nursing system model. So you can go through that, and thanks for watching all this time. Thank you.